Well, good afternoon, fellow constitutionalists. This is actually third video in a short series about Bernie Sanders' Medicare for All town hall, and I'm just going through and rebutting some of the biggest fallacies he's putting out in there. I know there's going to be a lot of people out there that's going to disagree with me, but that's okay because I actually source my stuff and have facts on my side, whereas Bernie Sanders he cited zero, zero sources for what he's doing. He did have some quote-unquote experts on his panel, but those experts were not rebutted for some of the falsehoods they were saying. And it's very, very important for us to understand this, folks, that it's not what everybody thinks it is out there. Now, we're going to talk about the cost, a high cost of American health care. That's what Bernie Sanders was actually hammering on. Oh, it's the high cost of the health care system, right? And he brought some guests on, and they talked about this. And this one's probably going to be my longest video in this series. But this is very, very important because some of the things that some of the business people he had on there and some of the doctors he had on there were not telling the truth. One of the doctors actually repeated the fallacy that 36,000 people are going to die each year without Obamacare, without health insurance. That I proved 2 videos ago that's a fallacy. It's an assumption based on other assumptions that are not based in real world facts or real world situations. And so in this, what I'm going to do here, let me see here. I'm going to play this. I want to play this clip from Cenk Uygur from his little advertising show for the town hall. His comments about the town hall. And then I'm going to put up a comparison chart for healthcare costs per capita. And, well, no, before I do that, I want to put up the a U.S.-Norway campaign. Matter of fact, I want to do that before I do the video about Cenk talking about the high cost of healthcare. So let me get this put up over here. And basically, what you're going to see here, and this is, to me, this is kind of funny. U.S., Canada, Norway comparison 2017. Now, my sources for these was the GDP percentage of tax is from the Heritage Foundation. The GDP of the countries is from the International Monetary Fund, and the population stats were from Wikipedia. So I know some people are going to complain about my sources, but they were like the best ones I could find for all this. Now, the U.S. population has 325 million. The gross domestic product is 18.62 trillion. The per capita income in America is 61,687. And the tax rate as percentage of GDP is 26%. That's the taxes we pay. And I'm pretty sure that's all of our taxes together. But I'm not, they didn't separate that out, but I'm thinking that's all of our taxes are state, federal, local taxes. Now, the next one down, Canada's population is 35 million. Their GDP is 1.52 trillion, which is pretty good for 35 million folks. And their per capita income is 46,199. Now, these are all in U.S. dollars, real dollars, okay? And their tax rate, percentage of GDP, is 39.8%. Now look at the number, and you got to keep these two in together here, the per capita income and the tax rate percentage of GDP. Now Norway has a population of 5.2 million. The GDP is 370.4 million. The per capita income is 72,702. And their tax rate as a percentage of GDP is 54.8%. And I was like, wow. So you look at that. Per capita America is 61,687. Now I understand that not everybody makes that, but what they do is they take the population and they divide it by the GDP, and that's what they come up with the per capita. And that's one of the easiest ways you can figure the wealth of a country out. So we have the lowest tax rate as a percentage of GDP, and that's not including what's going to happen this next year in 2018 because of our tax reduction. So that number is actually going to drop, and I bet you our per capita is going to climb with the economy going the way it's going. Now, In Canada, they make about 14,000, 15,000 less per capita than we do in America, and their tax rate is 39.8, almost 40% of their GDP is in taxes. Okay, and Norway has 54%. Now they have a higher per capita income, 72,000, just about 10 grand more. Okay, but they are double our tax rate as a percentage of GDP. And so you got to compare apples to apples. And what Cenk and Bernie do is they're not comparing apples to apples. Now let me get over and play this clip for you from Cenk.
And that's what we have in America. And so let's just acknowledge the depth of the problem. Then you talk about, how about finances? You know, Republicans always say, oh, it costs too much. No, it's the exact opposite of the truth. That's why it's maddening that this wasn't covered by cable news outlets, et cetera. We covered it, but it's so many of their advertisers put out this propaganda, which then you hear in cable news. But the reality is, it costs $9,800 per person in America, for every person, healthcare costs every year. So Canada has a life expectancy that is 3 years older than ours. They have a system measured by doctors and experts that is demonstrably better than us. They have better healthcare than us. You know how much it costs them? Well, if it costs $9,800 per person for us, it must cost them what, 15,000? We're 10,000, 50? No, 4,600. We cost 9,800, get worse results. They cost 4,600, get better results. So why are we doing this? Another doctor said, look, I spent half my time filling out insurance forms. Bureaucracy? We're talking about bureaucracy? All I deal with is insurance bureaucrats. Hey, my patient is dying, for God's sake, can I give them some sort of treatment? Well, I don't know, you fill out the forms and have them fill out the forms and we'll see what happens.
Now, let me make some points on what he's talking about there. When he talks about it costs less in Canada, we'll just stick with Canada for right now. It costs less per person, okay, in Canada, like half what it does over here. Now, what I did, and it just dawned on me, I didn't even do this math here. They are at, I'm going to say, for all intents and purposes, at 40% of their GDP, Canada pays in taxes. And we're at 26%, so we're talking about 14 percentage points less than Canada. So you have to take that in consideration, how much money you're taking away from the people in order to afford your socialist society, and add that to the cost. He doesn't do that. Matter of fact, he doesn't even compare apples to apples. Now what he's doing is taking the total healthcare costs is like 3.2 trillion here in America, total healthcare expenditures, and dividing it by 320 million, and that's where he's getting his $9,000 figure. And I went through and actually took the Medicare and Medicaid recipients, added those together, and as you see on this slide here, according to the CMS.gov, the Center for Medicaid and Medicare Services, or Medicare and Medicaid Services, Medicare spending grew 3.6% to $67.1 billion in 2016. And I'm not going to go through all the numbers. You can see them there. Medicaid spending grew, it's at $565.5 billion in 2016. That's $1.237 trillion divided by the 128 million people on Medicare and Medicaid. That works out to $9,664 per person spent by the U.S. government. And remember, the U.S. government doesn't have any money unless they tax the people, so they're actually taking money out of your and my pocket to pay for this. So that's another burden on the American taxpayer that they're probably not figuring out in here. Okay? Which every time they take $1 in taxes, it's taking $1 that I could spend somewhere else. Now remember that. Private health insurance spending grew 5.1% to $1.123 trillion. 1,234 trillion, okay? And or billion, excuse me. No, that was trillion. I got the wrong number in there. I put billion instead of trillion. I apologize for that, folks. I got to fix that slide. In 2016, so it's $1.23 trillion in 2016. Out-of-pocket expenditures are at $352.5 billion in 2016. So that's $1.694 trillion divided by the 192 million people on private and out-of-pocket expenses. That works out to $8,822 per person spent in the private sector. So actually, like I said, Cenk is using an economic, I want to call it economic voodoo trick or shell game here, where he wants to compare the apples that are the Canadian healthcare system and the taxing of the people there to the oranges that we have here in America. And again, the one thing that I watched the whole thing, they never talked about how much in taxes, the exact amount, percentages or whatever in taxes that they spend, or they actually confiscate from the people in Norway and Canada that are way higher than the United States. And that actually makes them, there's some articles, if you go through the articles and read them, that actually makes Canada, their folks less rich, because after they take all the taxes out, they have less money because they have less per capita, and they're paying for this health care. Now this, let me get down here. All right, this next clip is too many people profit off of health care, and this is by Dr. Claudia Fagan. Now, she's a doctor at Woodland Health Center in Chicago, and Bernie Sanders, and I tried to research, couldn't find the number, estimated 1 million people come through this particular health center a year. That seems an awful lot to me, but I'll leave that stand. I'm not going to dispute that. But what she's talking about, and Cenk talked about it in that last video clip about the bureaucracies. Now, he was talking about the insurance bureaucracies, but you know what? The insurance bureaucracies are there because the federal bureaucracy did something. They passed a regulation or they passed a law that people have to follow. Now, again, here's this clip here. The lady talking in here, and Bernie Sanders is going to introduce her. Her name's Dr. Claudia Fagan of Chicago Hospital Woodlawn Health Center.
Okay, let me jump in here because I want to go to Dr. Claudia Fagan. Dr. Fagan is the Chief Medical Officer at Cook County Health and Hospital System in Chicago. During the course of a year, I believe you have 1 million visits. I mean, it's a huge enterprise. Mostly lower-income people, often people of color. What are you seeing in Chicago, Dr. Fagan?
Well, I can tell you that 36,000 people died in the United States in 2016 as a result of being uninsured, and that we base access to health care in this country on your ability to pay for it and not on your need for care. So I work in this large public system, and every day people come to see us with advanced disease because they don't have insurance, and they thought that they could manage their problems until times got better, but they got too sick and they had to come in to be seen. I could tell you about a 56-year-old cook with hypertension who had no medications and had a stroke on his way home from work. I could talk about the 64-year-old salesman, also with hypertension, who thought he could wait until he turned 65 and got Medicare to take care of his high blood pressure, but that little bit of nausea he developed was kidney failure, and now he needs dialysis. I could tell you about the 50-year-old with diabetes who had no medication, who came in with his blood sugar so high that he developed such severe nausea and vomiting, he tore his esophagus. So he came in to see us bleeding, dehydrated, and in diabetic ketoacidosis. But I probably will never forget the 54-year-old woman who was a nurse's aide who came into us after struggling for months with difficulty swallowing, and we diagnosed her with advanced esophageal cancer. And I remember telling her that we could put in a feeding tube and talking to her about putting her affairs in order. And she wanted me to arrange for her radiation treatment to be given in the early evening or late afternoon so that she could continue to work. because what she knew was that if she couldn't continue to work, she wouldn't be able to pay her bills, including her rent. And if she couldn't pay her bills, nothing else mattered. So what we see is that we have studies that show that people who do not have insurance delay in seeking care for heart attacks, that people who have co-payments for medication, no matter how low, it decreases the utilization of much-needed medications, decreases the uses of blood pressure medicine, decreases the use of diabetic medication, and cholesterol-lowering statins. We know that the higher the co-payment, the poorer the outcome for children with asthma. So we need to make health care a right in this country. The reality is that we already spend enough money on health care in this country. We just allow too many people who are not involved in the delivery of health care to take profit from it.
Too many people not directly involved in healthcare to take profit from it. Government bureaucracies, folks, are the biggest ones. And this thing with socialists about people making money, about profits, is an old broken out record. They don't want the pharmaceutical companies, they don't want the medical supply companies to make any profits off of anybody. And I challenge Bernie Sanders, I challenge Cenk Uygur of the Young Turks, if they can go run one of these multi-billion-dollar corporations and make it profitable. I bet you they can't do it. Cenk might, because he's a business guy, but if he comes into it with his regressive economics, his Keynesian economics, and his false ideas and that, he'll run a pharmaceutical company into a ground. Now, what you see up on the screen here this time is healthcare is mostly a function of supply. And one of the things they don't tell you about in these socialized countries is they limit the supply of healthcare. England, the UK is going through a mess, and they didn't even talk about it. That 50,000 non-life-threatening procedures had to be delayed because they don't have enough beds, they don't have enough money, they don't have enough resources. They got enough doctors, they got the same ratio of doctors as we in the United States do. What's the problem? What's the problem? And therein lies the answer. What is the problem? The problem is they don't have the market signals working in the healthcare industry in America or throughout the world that would tell them if something's working or isn't working. They're all these, and I don't have anything against any of these folks. Dr. Fegan, don't have anything against her or anybody else on there, except they want to give away the store and they're using false data to bolster their position. But they don't even know. They don't even know about healthcare, about the economics of healthcare, and healthcare being mostly a function of supply. The amount that a country spends on healthcare is mostly a function of supply. In fact, the amount that an individual state within the U.S. spends on healthcare is mostly a function of supply. One of the reasons that Massachusetts is a difficult state in which to try to offer universal coverage is that the supply of specialists and high-tech equipment is so high there. Given the vast supply of expensive healthcare providers in the United States, there is reason to doubt that shifting it to a universal system provided by the government would bring down spending. Matter of fact, it would add another layer of bureaucracy that will add more cost, which I know Bernie Sanders and Cenk and anybody else that's supporting Medicare for all doesn't even add that into the equation. How much is it costing us at a governmental level to have these bureaucracies that govern all this stuff that cause the insurance to be more for everybody? Obamacare made the individual healthcare markets more expensive. That's a fact. And it just, again, they just missed the whole point about supply and demand in an economy. They really do. Now, Dr. Fagan's going to make another comment about here. This is not healthcare at all.
Let me ask a question. Tell me if I'm wrong, but I expect some of the people who actually walk in your door do have health insurance, but their deductibles and co-payments are so high they can't get to the doctor when they need it. Would that be true?
That's exactly right. So when you see someone who has health insurance, but their deductible is 10% of their income, $35,000 a year with a $3,500 deductible, that's not insurance.
And she's absolutely right. That isn't insurance, and that's exactly where we went to under Obamacare. Our premiums went up. Our deductibles went up to try to keep the premiums down. And I knew families of four that had $12,000 a year in deductibles. Matter of fact, I was offered insurance through a temporary agency, and a family plan would have been $12,000. Just me and my wife. It'd be $6,000 deductible for me and $6,000 for her. And I refused it. I said, I'll just take my chances. And I'm diabetic and I have sleep apnea. And now I've developed fibromyalgia. And I'm doing a lot of things myself to try to correct some of these situations. Diet, exercise. With the fibromyalgia, I'm trying to get away from commercially made products, and I make my own coffee creamer that doesn't have any chemicals in it. We make our own pancakes on Saturday morning, and I try to eat a really good diet. 3 times a week, I go swimming at the Y for an hour, do therapy for my fibromyalgia. And I try to take care of myself so I don't have to pay that deductible and stuff like this. Now, I have this chart up here. And this is another thing that the liberals do not talk to you about at all. This chart is price changes from 1996 to 2016, selected consumer goods and services. And if you look at that 60% line, and you go above that, everything that's above that 60% line is above it because of government regulations. Okay, cars are just above it, and housing are just above it. But then you go up to child care and medical care. They've increased. Child care has increased 122%, and medical care has increased 105%. College tuition has increased 197%, and textbooks have increased 207%. And every one of those increases are directly related to some type of government interference, either regulation or, in the case of tuition and textbooks, they got these Pell Grants and these government-backed student loans. And if colleges and universities know that they're going to get paid no matter what the student does, they jack their prices up. There's no competition in the colleges for that. There's only one college I know of personally. I don't know all of them. But Hillsdale College does not take any type of government financial aid or anything of their students. You come there, you pay for your liberal arts degree, and with regular loans and that, you do not get government-backed loans or Pell Grants or from the government or anything. They just refuse to take them, and their cost, I can't remember what it was this last year, but it's way below the national average for that. Now, speaking of businesses, and I said this one's going to be just a little bit longer. This next video is of a CEO of MCS Industries over in Easton, PA. They make picture frames and table frames, stuff like that. His name's Richard Master. Now, their company, and Bernie will say this in the video here, their company has a gross income of $200 million a year. And he says he spends like $2.5 million, something like that, a year just on for his 180 employees just for health care. That's only 1.5% of his gross income that he actually pays on health care for his employees. That's pennies on the dollar. Pennies on the dollar compared to how much the company's actually making. Now, he's going to say some things in here, and we'll come back afterwards and we'll talk about this real quick. But I just wanted you to listen to this and see what he has to say about health care, government single-payer health care.
Economy, what does it mean for international competitiveness when we're spending so much more than other countries that guarantee health care to all people? And we've got a great panel to discuss some of these issues. Let's start with Richard Master. Richard is the founder and CEO of MCS Industries in Eastern Pennsylvania. And this is a company which does about $200 million a year in business. And for a number of years now, he has been very active in the fight for single payer. Richard, you're a business guy. Why is single payer sensible to you and to the business community?
Senator, about 5 years ago, after many, many years, 10 years of volatility in cost and demands from insurance companies annually for increase in premiums, I realized that this was something that I had to get involved in as a patriotic American. Our company employs 180 people in Pennsylvania and throughout the United States. Our health care bill is $2.8 million a year. It cost $27,000 to insure an employee with a family. That's $13.50 an hour, which is, if you put this into context, it is about as much as 1/3 of the population can't make in a year. So this is an outrageous cost. We're beyond the tipping point at this point. We have really got to do something to control costs. Now, we look at the Medicare for All solution. Right now, we are spending about 18% of payroll for health care costs, for health insurance. We look at Medicare, the model for Medicare for All, it's 10%. We could be saving tremendous amounts of money, and we would be relieving our employees of the anxiety of maybe not being able to pay their deductibles and copays.
As an employer of a couple of hundred people, how many people do you have?
180.
180 people. What would it mean to you to know that every one of your employees had good quality health care, and it's not an issue that you have to spend half your life worrying about?
It would mean so much to the spirit of our organization. We're a caring company. We provide scholarships for our employees to go to the community college and other colleges and to their children. And we see day after day employees that are threatened with bankruptcy. Now, what we have done, we've had insurance policies, and then we have a secondary insurance policy that takes care of the deductible so that our employees don't have that anxiety. But that's the reason for the massive expense. The $27,000 a year, that's approximately the cost for average cost across the country for a family of 4 in this country.
Are you finding more and more people in the business community going beyond ideology and understanding that Medicare for All would be a good policy for them from a business perspective?
Yes, we're seeing that. We started an organization called the Business Initiative for Health Policy, and we're getting substantial support for that. We started another organization called Business Leaders Transforming Healthcare. In California, we have 300 members, business members, for the Business Alliance for a Healthy California. We have other memberships, 200, 300 members across the United States. New York is starting an organization. Ohio is starting an organization. Yes, there is momentum.
Yes, there is momentum. Let me tell you a little bit of something about Mr. Master there. Him and these other business folks that Bernie Sanders had up on the stage here, on the panel. This is a guy, and the other business owners like him are looking to dump. They're looking to dump their health care, their health insurance cost on the American taxpayers. That's exactly what they're trying to do. That's exactly what they're trying to do. And the reason why, again, the reason why a family of four in health insurance expenses now, that's what we're talking about, expenses. He's talking, like I said, I'm looking at some numbers and stuff like that, and I don't see, we had, back when I had both kids on the insurance policy, before Obamacare and everything, we had really good insurance because it paid for my daughter's brain surgery and everything, which came to almost $100,000. I didn't have to pay a dime out of pocket, and my share plus the company share didn't even come to $10,000 a year. That was just the health insurance. They're talking about what they're doing is they're using these numbers on this healthcare expenditure, and he's just timesing it by 4. You know, oh, it's $27,000 a year. You know, that's what they extrapolate it out as. Not every one of his employees are going to spend $8,000, $9,000 a year on healthcare costs. It's just not going to happen. But what these guys want to do is they want to shift that 2.8, almost 3 million, or 1.5% of his gross income. They want to shift it off their books and put it on the American taxpayers. He's going to pocket, when he does that, he'll be able to pocket another $3.8 million for the company when he does that. And these other businessmen, I can't say for sure that this is exactly what they're doing, but this is a motivating factor. If they can dump $3 million, that's more money in his pocket. And they talk about the right being greedy. It seems to me those folks on the left that support socialism are the ones that are greedy and envious of everybody else. They really are. Now, again, it just amazes me how people don't pick up on this type of stuff. And the other two people sitting up there, the lady was another business person, and the man was a doctor that helped implement Obamacare under Barack Obama, and I didn't catch his name. I didn't really care. I'm like, you know, thank you very much for messing up a system, our healthcare system. So all this Bernie Sanders and Jank and Mr. Masters and Dr. Fegan, they all want to shift the cost to the taxpayers. And the one thing that they forget, and Dr. Fegan, I should have mentioned this when I was talking about her, the one thing she forgets is the community people live in. I've seen, especially with the advent of GoFundMe and other online, funding sources. My brother-in-law's cousin was in a bad motorcycle accident, and his insurance wasn't going to cover everything. Guess what? They went on GoFundMe and started GoFundMe, took care of it. A lot of people are doing that nowadays. Churches help out when folks get down on their luck like that, or their insurance is bad because the government made it bad. Now the government wants to put forth a solution to fix what the government broke to begin with. That makes no sense whatsoever to me. Now the final thing I want to talk about, and this to me, again, is just funny. I mean, it's funny, tragic actually. Why luxury TVs are affordable when basic health care is not. Imagine this, you are feeling under the weather, you pull out your smartphone and click an RX app. A nurse arrives in 20 minutes in your home. She gives you a blood test and recommends to the doctor that she prescribe a treatment. It is sent to CVS down the street, which delivers to your door in 20 minutes. The entire event costs $20. Sounds nuts. Not so much. Not if healthcare were a competitive industry. As it is, medical care prices are up 150% in the last 20 years. This contrasts with the television industry, which is selling products that have fallen 96% in the same period. And I showed you that table a little bit earlier, and I wanted to put that in between those two clips for a reason. Take a look at the chart assembled by an American Enterprise Institute. It reveals two important points. First, there's no such thing as an aggregate price level, or rather, what we call the price level is a statistical fiction. Second, it shows that competitive industries offer goods and services that are falling in prices due to market pressure. In contrast, monopolized industries can exact either higher rents from people based on restriction. Folks, this whole healthcare issue in the United States, I don't care about these other countries, the whole healthcare issue in the United States is government caused. It's caused by socialist regressives like Bernie Sanders and Cenk Uygur. It's caused by these businessmen that want to dump the cost of their health insurance off onto the taxpayers. And they're just, to me, that's just being greedy. If that's what's going on, they're just being greedy. And folks, I just have that sneaking suspicion that that's exactly what's going on, and we need to stop it. We need to bring this country back onto, or get it back to where it used to be on a free market system. Let the free market and market pressures determine the prices and the cost of everything. We do that, and you're going to see the cost of health insurance go down. You're going to see the cost of medical care go down, and we're going to be way cheaper and even better than these other countries. And final thought here, the one reason why here in the United States of America our health insurance actually costs a little more, or our health expenditures cost a little more, because we get the service. We get the service. I talked a video ago about the wait time in these other countries. And these other countries have to wait. We pay for the service. I can go to my doctor and get an appointment today if I had to. It's been the Dan Columbus Show. I'm your host, Dan Columbus, your constitutional warrior. Remember, if you aim at nothing, you'll hit it every time. Have a great rest of the day, folks, and God bless, and we'll see you tomorrow.